Pathology is a vital subject in the NEET PG examination, encompassing the study of disease mechanisms, diagnostic approaches, and laboratory medicine. It is broadly divided into general pathology, which covers fundamental concepts like cellular injury, inflammation, and neoplasia, and systemic pathology, focusing on organ-specific diseases. Important topics include cellular adaptations, hypertrophy, atrophy, cell death mechanisms, necrosis, apoptosis, and inflammatory processes, acute versus chronic inflammation, wound healing. Hemodynamic disorders such as thrombosis, embolism, and shock are frequently tested, along with neoplasia, where understanding tumor classification, carcinogenesis, and cancer markers is crucial. Hematopathology is another high-yield area, including anemias, leukemias, and lymphomas, while immunopathology covers hypersensitivity reactions and autoimmune diseases. Infectious pathologies, bacterial, viral, fungal, and systemic disorders affecting the cardiovascular, renal, hepatic, and nervous systems are also essential. For NEET PG, emphasis is placed on histopathological findings, diagnostic tests, e.g., Coombs test, tumor markers like PSA and CA-125, and genetic disorders, e.g., sickle cell anemia, cystic fibrosis. Recommended resources include standard textbooks like Robbins and Cotran, Harsh-Mohan, and online platforms Marrow Prep Ladder. For concise revisions, a strong grasp of pathology not only aids in scoring well, but also forms the backbone of clinical practice in various specialties. Master the basics. Core concepts in NEET PG pathology involves building a strong foundation in fundamental principles essential for understanding disease processes. Key areas include cellular adaptations, hypertrophy, atrophy, cell injury, necrosis, apoptosis, inflammation, acute versus chronic mediators, and hemodynamic disorders, thrombosis, infarction. Neoplasia concepts like benign versus malignant tumors, carcinogenesis, and metastasis are crucial. Additionally, focus on hematopathology, anemias, leukemias, immunopathology, autoimmune diseases, hypersensitivity, and systemic pathologies, CVD, renal, hepatic. Mastering these basics ensures clarity in advanced topics and aids in accurate diagnosis, making them high yield for exams. Use Robin for in-depth understanding and Harsh-Mohan for exam-oriented revision. Strategic study techniques for NEET PG pathology involve focused, high-yield learning to maximize efficiency. Prioritize exam-favorite topics like neoplasia, hematopathology, and immunopathology. Use active recall with flashcards and self-quizzing. Solve previous year's MCQs to identify patterns. Supplement Robbins textbooks with concise notes, e.g., Harsh-Mohan, Marrow/Prep Ladder. Concept mapping helps link pathologies with clinical correlates. Dedicate time to image-based questions, histopathology, lab findings. Regular time mock tests improve speed and accuracy. Balance depth with repetition. Revise weak areas weekly. Allocate time wisely. 3 to 4 minutes per question to ensure completion. Start with high-confidence questions to secure easy marks, flagging uncertain ones. Dedicate 15 to 20 minutes to image-based questions, histopathology, gross specimens, as they require careful analysis. Avoid overthinking. Stick to first instincts unless clearly wrong. Reserve the last 30 minutes for flagged questions and review. Prioritize high-yield topics, neoplasia, hematology, if time runs short. Stay calm. Skip prolonged debates and return later. Proper pacing ensures all sections are attempted, maximizing scoring potential. Last-minute success tips for NEET PG pathology. 1. Focus on high-yield topics. Revise frequently tested areas. Neoplasia, carcinogenesis, grading/staging. Hematopathology, anemias, leukemias, and immunopathology, autoimmune diseases. 2. Quick review charts. Use summary tables for tumor markers, coagulation cascades, and inflammatory mediators for rapid recall. 3. Image-based prep. Skim through classic histopathology slides, e.g., Reed-Sternberg cells granulomas, and gross specimens, e.g. infarcts, tumors. 4. Mnemonics and short notes. Reinforce tricky concepts, e.g. NAASP for causes of bone marrow fibrosis, with mnemonics. 5. Avoid new topics. Stick to familiar material. Don't overwhelm yourself with unstudied content. 6. Mock test reflections. Revisit mistakes from practice tests to avoid repetition. 7. Stay calm and hydrated. Manage stress with deep breathing. Clarity beats cramming. Thank you for watching Medicology with Pro Farouk.